And these were some of the most dedicated workers in the healthcare system. Many of them were long-term employees, mostly immigrant women. Many of them had English as a second language. They didn't have many other skills to go out onto the street and find another job tomorrow. It was so, they were proudly working at the laundry for the health authority. We're proud of the work they were doing, but we were just being treated like crap. And when this happened, it was like, we're out of here and we're not going to take this crap. And it was like wildfire. And when they proudly, with the help of their union, CUPE and their union leaders from the General Hospital and their staff reps, decided that, yeah, we're going to go ahead and we're going to do this. It was a wonderful thing in the city of Calgary, because you have to realize at the time, workers were being crapped on by the government, always crapped on by the Calgary media, like it's just a dispensable group of people that we can get rid of whenever we want. And the doctors took crap, the nurses didn't stand up to them, the healthcare workers didn't stand up to them as well. And then all of a sudden, it was some of the lowest paid, the lowest skilled, lowest trained workers in the healthcare system said, we're going to show you how to lead, and they did it.
And so the two places where they walked out of, I want you to say just for the tape.
Yeah, so the first day, under the leadership of CUPE, the workers at the Calgary General Hospital, what the health authority used to call the Bow Valley site, but the Calgary General Hospital in Bridgeland, where it had been for close to 100 years, those workers walked out of the laundry site, and they decided that was the thing to do, and it was amazing. Usually in the last couple decades in Calgary prior to that, when workers went on strike, the citizens crucified them, the media crucified them, the politicians had a heyday, and the first couple hours were like that, but it quickly changed, and as things evolved, for whatever reasons, many people in the general public, many people who have never supported unions or workers' rights in their lives came out very, very much in support of the laundry workers and those proud women that led the way for all Calgarians and all healthcare users. And it wasn't very long after that another proud group of workers, very similar workers, the same backgrounds, the same skills, working in the same jobs, but at a different hospital, the Foothills Provincial Hospital in the Northwest. And they would have belonged to another union. The first group would have been the Canadian Union of Public Employees at the General Hospital, the Alberta Union of Provincial Employees, Local 55 workers, in their hospital at the Foothills. In the laundry, they did similar actions and joined the workers at the Bow Valley. So the first couple of days, you had some great solidarity from two unions that didn't hate each other, but didn't work as closely together as they could have over the, through the 80s and 90s. And here, all of a sudden, some of their members, and many of them had never been to a union meeting in their lives, many of them had never held union positions in their lives, were showing unions how to act, how to challenge the employer, how to challenge the media, how to challenge the government, and how to act together and work together and accomplish things. It was absolutely amazing. Often when there's a group of workers going on a work site, the other workers that remain there for whatever reason, whether it's their beliefs or provincial laws or whatever, don't support the workers who are out. But in this case, it was fabulous. You couldn't find a person who worked in the healthcare system that wasn't supporting the laundry workers. And if you had gone back a week before that, you probably couldn't find a person in the healthcare system that was in support of the laundry workers. Yeah. That's how it flipped in just such a short period of time. You couldn't have planned it. You couldn't have written the script. But it evolved, and it was like day after day, and it was probably the one time in my life, excuse me, for about a 2-week period where the question I was asked is, when's the next union meeting? It was phenomenal. AUPE and CUPE had joint union meetings. They allowed myself as a representative of the Labour Council. They allowed the general public. You had people who never belonged to a union, were in at the union meetings, were involved in the debate. Obviously, they couldn't vote on the contracts and vote on the things, but it was amazing when people from the general public and people from other unions wanted to. And honestly, the question was, when's the next union meeting? And it's not the experience I've seen in the last 30 years, having spent my life attending union meetings. But everything from that, we had to rent community halls. We didn't have spaces big enough. You couldn't have the meeting in the union hall because the union hall wasn't big enough. So we had community centers in the east for the Bridgeland and the General Hospital workers. We had community halls in the Northwest for the AUP and the Foothills workers.